you can be sure that your teeth are in good shape. No cavities, nothing hurts. You brush your teeth every day, so there shouldn't be any bad breath either. Makes sense. But it's in exactly this situation that many people still have bad breath and they don't notice it themselves. And the most unpleasant part is that people around you almost never tell you about it. Maybe you've already started to notice some strange things. People distance themselves a little, conversations become shorter. It's awkward to ask directly. And it's unclear how to check. And a person can live with this problem for years, not even suspecting that they have bad breath. So now I'll tell you how to figure out if you have bad breath, how to identify the source of the odor without leaving your home, and in which cases bad breath is actually normal. I'll explain how to determine the cause of bad breath at home at the end of the video. Watch until the end. Bad breath has a scientific name, halitosis. In this video, we will be discussing specifically foul, unpleasant odors. Do not confuse them under any circumstances with natural odors. That is, the smell in the morning when we wake up is a natural odor, because at night the activity of the salivary glands is not as strong, and the main factor that helps us maintain oral hygiene is our natural saliva, which is produced in smaller amounts at night. In addition, the patient may breathe through their mouth at night, causing the mucous membrane to dry out, which is why this specific morning odor appears. This is absolutely normal. A person may also consume garlic, onions, or certain spices. So these kinds of natural odors are normal. We won't be talking about those right now. We're talking about foul odors that are unpleasant not only to the person who has them, but also to those around them. Let's start with how to actually detect bad breath, because it's very rare or almost impossible for a person to notice their own bad breath. The first reason is that when we breathe through our nose, we simply don't notice our own odor because we're breathing nasally. And when we breathe or exhale through our mouth, most often the air comes out horizontally, so the nose doesn't have time to catch these vapors, these smells. That's why the simplest and most common way is to cup your hand, breathe into your palm, and immediately sniff it. And that's when we can detect the smell. Sometimes the person either gets used to this smell or they actually have a very low sensitivity to odors. And then there's another way. You can ask someone close to you, just ask them, say, smell my breath and tell me how it smells, and have them get really close to your nose. And usually, an outsider will immediately tell you whether there is any odor or not. The first and most common cause of bad breath is diseases of the teeth and gums. And this accounts for up to 90% of the causes. So most of the causes are related only to the teeth and gums. Well, first of all, of course, it's cavities, decayed teeth, or remnants of teeth, the so-called roots that the patient hasn't had removed. In other words, anything related to decayed, untreated teeth. But if everything is fine, all your teeth are treated, there isn't a single cavity, and you also brush properly twice a day, morning and evening, yet you still have bad breath. Here, another factor comes into play, gum disease. You should pay attention if your gums are loose, hyperemic, as we call it, or in other words, red and inflamed. And if, God forbid, there is also bleeding, if your gums bleed, this is the main cause of bad breath. Blood is a very powerful nutrient medium, and when blood clots in the mouth, it starts to decompose, bacteria join in, and it is the blood that causes this foul, unpleasant odor.
But how can a person even tell if their gums are bleeding? Because it's one of those things where, say, your gums start bleeding, you swallow it, and you don't see anything in the mirror.
Yes, that's absolutely right. A person might not notice, and they could just swallow the blood, and it won't, let's say, it won't be visibly coming out. But the first thing they should pay attention to when brushing their teeth is the gum or the papilla around each tooth. Most often this is immediately noticeable. That is, the gum is red, inflamed, and kind of loose. And first of all, it becomes painful to brush. While brushing, the patient even tries to avoid that area. And if they accidentally touch it, blood immediately appears either on the toothbrush or when spitting out the toothpaste. It's instantly noticeable. We even see this kind of advertisement ourselves. Very often they show it on TV, advertising different toothpaste when a person spits out the toothpaste and there's blood in it. So a person whose gums are bleeding will definitely notice it. Here I ask you not to confuse a one-time or temporary gum injury. For example, sometimes we all buy the wrong toothbrush, a new one, and accidentally, if it's rougher, we injure the gum. The papilla is actually very delicate, and so a small amount of blood comes out. That's normal. So if you injure it once, you realize you did it, either with an awkward or careless movement while brushing your teeth, or simply because the brush is too rough. That's one thing. But if you notice this happening systematically, let me repeat, for patients who experience this, it's usually a recurring issue. For a day, 2 or 3, there's bleeding and it's painful to brush certain areas. They avoid those spots brushing gently and carefully, so they notice it right away.
So does it hurt then?
Yes, it definitely hurts. So a bleeding gum will definitely hurt, but there can also be another symptom. Sometimes it seems like nothing hurts anymore, but there's noticeable tooth mobility. The tooth is actually loose and the person can feel it themselves. Normally our teeth are not mobile, and this as well, but this is already a different condition. If at the beginning we talked about gingivitis, inflammation of the gums, then this is definitely periodontitis or periodontal disease when there is tooth mobility and it's already to such an extent that we can no longer see it just by looking at the gums. The gum has adapted, in fact it has even receded and it's not as, let's say, loose. But at the same time there is this tooth mobility. Tooth mobility can also be accompanied by bleeding. So what should you do if you notice this problem in yourself? It's absolutely logical. If your teeth are damaged, you have a lot of cavities, or there are remnants of teeth that haven't been removed, it's immediately clear that you need to seek dental care. But when all your teeth are healthy, you brush well, and yet you still notice bleeding, meaning your gums are bleeding, then you absolutely must, I would even say, rush to the doctor, because this is a very insidious symptom. Besides the fact that it's simply bad breath, as if it will just go away. There's actually a very deep process happening with your teeth that you don't notice. So what's the insidious part? Your tooth is healthy, but it's bleeding. Well, nothing serious, but in reality, it's even more dangerous. You could lose a completely healthy tooth. That's why I urge you not to joke around or experiment when it comes to bleeding gums. As soon as you notice that your gums are bleeding for a day, 2 or 3, you must go see a dentist. The second cause of bad breath is diseases of the oropharynx and nasopharynx. Most often we're talking about so-called chronic tonsillitis. It's also called a cold sore throat and commonly referred to as tonsil stones. This is very easy to check. That is, your teeth can be completely healthy, your gums absolutely healthy, with no warning signs at all. The patient may have absolutely perfect dental health, but the smell is incredibly foul. And when the patient opens their mouth wide, you go up to a mirror, open your mouth, and you can see on the tonsils, each tonsil has these indentations, which we call lacunae. And in these lacunae, in these depressions, in these craters, like on the moon, there are these white or yellow plugs. This is exactly what is called chronic tonsillitis. These are remnants of food that get stuck in such a hypertrophied tonsil. This is most often a patient who frequently suffers from tonsillitis. The tonsil becomes enlarged and remains loose and hypertrophied. Food particles get trapped in it. All of this decays, and that's how such a plug forms. Sometimes such a plug can come out naturally and the person can feel it. And even if you smell it, the odor is incredibly foul, but unfortunately people live with it. That's why these plugs are cleaned out. Doctors clean them, ENT specialists. You come in and get them cleaned. Of course, you need to watch your diet and maintain proper hydration. There is specific treatment, but this cause of foul odor is one of the most common. Chronic rhinitis, sinusitis, and pharyngitis can also be classified as diseases of the nasopharynx. Anything related to the nasopharynx can also cause this kind of unpleasant mouth odor. How is this treated? Of course, this is treated only by an ENT doctor. Make an appointment with an ENT doctor and ask all your questions to the ENT specialist. So if you have this odor, the ENT doctor will quickly examine you using special equipment. It's a routine checkup. And if any additional examinations or tests are needed, the doctor will of course prescribe them, but usually the ENT doctor can very quickly determine the source of the odor. But in my opinion, the main cause is still what is called cold angina. The third cause of bad breath, strangely enough, is the so-called stomach odor. Very often, even during appointments, when you mention the stomach to patients, they just don't understand. What do teeth and the stomach have to do with each other? My stomach is down below, my teeth are up above. How could my breath smell because of my stomach? This is actually quite reasonable and even correct, because normally before the stomach there is the esophagus. That is, food first enters the esophagus and then the stomach. So how could there be an odor coming from the stomach at all? Especially since food travels down the esophagus. And between the esophagus and the stomach there is a sphincter. It opens, the food passes through, and normally of course it closes again. So our esophagus is not some kind of pipe like in a house, where all the smells come out from the stomach. No, of course not. But there are certain stomach conditions called reflux esophagitis. That is, when the contents of the stomach flow back into the esophagus. This happens in patients with low stomach acidity, or on the contrary, with high acidity. And the patient can really feel it. That is, well, let's call it belching, as people commonly say. You can really feel it. Suddenly you burp. Some people describe it as a sour, very unpleasant taste. Sometimes there's even a rotten smell, which most often happens with low acidity. There's actually a rotten odor coming out with this belching. So the third reason is a gastrointestinal tract disorder. As I said, these things might seem completely unrelated. So if you have this kind of reflux, esophagitis, or involuntary reflux, you definitely need to pay attention to it. And first, consult a dentist. So what should you do in this situation if you have this? Your teeth are fine, but you have this unpleasant belching. First, go to the dentist, show and explain your symptoms, and then be sure to see a gastroenterologist, or at least your regular primary care physician. And in fourth place is a completely non-obvious reason. I'll call it the reason of the 21st century. It's the psycho-emotional factor. Just listen to that for a moment. You might wonder, what does a psycho-emotional factor mean? What does stress or nervous tension mean? How could that possibly be connected to my bad breath? Nowadays, thank God, our medicine has become more accessible and comprehensive. We all know that the body is a system of constant interconnections. In other words, the body is an integrated system. Therefore, by psycho-emotional factor, I mean that when a person experiences severe chronic stress or depression, the salivary glands simply produce less saliva. I want to emphasize a very important point. It is saliva that is the main element in cleaning our teeth, not only from food particles, but it also kills bacteria. The more saliva is produced, the less odor there will be in the oral cavity. And during periods of stress, during such depressions or psycho-emotional tension, the salivary glands simply produce less saliva, leading to dryness in the mouth. The patient has absolutely no problems with their teeth, everything is great with their gastrointestinal tract, and everything is fine with their ENT organs, nasopharynx and oropharynx, yet there is still an odor. And this odor, it most often appears during the day. That is, there is a real dryness in the mouth, and the patient feels it. And so the psycho-emotional factor can also be a cause of bad breath because simply less saliva is produced. We all know what stress is, what depression is, what psycho-emotional tension is. The hormone cortisol, not only can it affect certain systems, but all the body systems start working in this specific mode, or on the contrary, stop working altogether. And of course, the salivary glands are also affected by this and react to stress and psycho-emotional tension in exactly the same way. How do you treat psycho-emotional tension, stress, and depression? Well, of course, it's probably easy to say, try to see everything in a positive light. Try not to think about anything. But that's very simple and it would seem trivial advice. Undoubtedly, it's very difficult to cope on your own. That's why the first thing you should do is, of course, go to a dentist so they can simply take a look and make sure there are definitely no dental issues. And if your teeth are truly fine, you don't have any gastrointestinal diseases, and there are no issues with your nasopharynx, then of course you should see either a psychotherapist, a psychiatrist, or a psychologist. That is, try in some way to deal with stress, or at least start taking some kind of calming medication. How can you determine the cause of bad breath? Is it actually your teeth or gums that smell, or is there another reason? And the first thing you should do is thoroughly brush your teeth. It's best to do this at the start of the day. So you wake up in the morning, have breakfast, go through all your rituals, coffee, tea, then brush your teeth, take some chlorhexidine, fill about 1/3 of a glass, and rinse your mouth. That is, you pour it directly into your mouth and rinse your oral cavity for at least 1 minute. Be very thorough, puff out your cheeks, let the liquid flow between your teeth. Really do it properly for at least a minute. After rinsing, spit it out, and you might need to spit a few more times because chlorhexidine is very bitter. Absolutely do not swallow it under any circumstances. So spit everything out and then just go about your day as usual. It's best not to drink anything for an hour afterwards. Why specifically chlorhexidine? Because chlorhexidine is a very powerful antiseptic. Just imagine we use it in dentistry to irrigate root canals when treating cavities. In other words, it kills all bacteria. And it's specifically bacteria, as I mentioned, that are the main source of odor, or more precisely, not the bacteria themselves, but the products of their activity. So by rinsing with chlorhexidine, you will kill all the bacteria in your oral cavity, and as a result, you'll have clarity. If the odor remains, then most likely the source is not the gums or teeth, but something deeper. So by using this simple and effective method, you can easily determine right at home, or at the very least differentiate, exactly where that bad breath is coming from. This allows you to pinpoint the source. And even though we now know that there are a wide variety of different underlying causes of bad breath, and we've even developed sophisticated methods to accurately identify exactly where it's coming from, whether it's originating from the stomach, the oral cavity, the nasopharynx, or even if it's directly connected to high levels of psychological stress. In any case, it is important to realize that any persistent bad breath is actually a direct consequence of certain underlying medical diseases. So it's not the cause. Therefore, if you notice bad breath, you definitely need to seek medical help. And at the very least, start by seeing a dentist. And if it's not within their specialty, the dentist will always recommend further examinations or refer you to other specialists. So seek medical assistance. If you found this helpful, give it a like and leave a comment. Take care of yourself and stay healthy.